To demonstrate palpation of the posterior gluteus medius versus the piriformis, the patient should be in the side lying 90-90 position. If you line yourself up with the femur, you'll be able to feel the greater trochanter by placing the heel of your hand right on the hip. So you'll feel the greater trochanter. From the top of the greater trochanter, find the PSIS, and this line between greater trochanter and PSIS, the center point of that line is the piriformis. And then you can take your hand and feel the iliac crest, the top of the iliac crest. About 1.5 inches below the top of the iliac crest is the posterior gluteus medius. So piriformis right here in line with the greater trochanter, between the greater trochanter and the PSIS, and then just below the convexity or concavity, if you will, on this side of the iliac crest is posterior glute med. And notice where my thumbs are. So my left thumb here is piriformis and my right one is posterior glute med. To palpate anterior gluteus medius, the patient can extend their hip, and you will find the anterior gluteus medius coming from the front, just behind the ASIS, and then extending down to the top of the greater trochanter. So again, use the heel of your hand to find that greater trochanter, find the top, and the anterior gluteus medius trigger point, if there is one, will be here, just behind and below the ASIS. If you bend up again, you can palpate the quadratus lumborum from this position as well. And so find the iliac crest. If you come in from the side, if you come from the back, you'll feel the roundness of the lumbar paraspinals. Go over the roundness of the paraspinals and then take your thumb and gently work in. Remember, the quadratus lumborum runs from the iliac crest to the 12th rib, and it is deep to the paraspinals. So that rectangular muscle, the trigger point, will be felt here. Again, find the roundness of the lumbar paraspinals, kind of go around to the side, and when you feel the roundness of the paraspinals end, that is when you gently press your thumb in, and this will be the quadratus lumborum trigger point.